Hey guys, Coach Adam coming to you today, and we have Travis of Fusion Physical Therapy, and we are on a mission to make Fredericksburg the healthiest and fittest city in America. So Travis, welcome, man.
Thanks, Todd. Thanks for having me, man.
No problem, brother. Good to have you. So hey, just tell the audience a little about Travis and Fusion. Where'd you start, and what brought you down here to Fredericksburg, brother?
Sure. So, many moons ago, I graduated from Shenna University with my doctorate in physical therapy, and I started working outpatient neurological rehab. So I was treating patients that have had strokes, brain injuries, spinal cord injuries, things of this nature. And I started getting really into treating that kind of patient population, but I missed a lot of the ortho stuff, the treating people with back injuries, ankle injuries, and stuff like that. So I had the opportunity to start working in aquatic rehab, and I ended up directing the physical therapy aquatic rehab program at Valley Health in Winchester. And I did that for a while, but I needed to get out of Winchester. I just needed a change, and so I started traveling, and I worked with Kaiser Permanente for a little bit. I got back into my orthopedic vibe. I then worked at an outpatient orthopedic center in Woodbridge, and now I was doing nothing but orthopedics, and that made me start missing all the neuro piece.
Gotcha.
And so I kind of had discussions with the owners of the clinic that I was at. Hey, we're sending all our neuro people away, but I have a lot of experience in it, and I really enjoyed treating it. And they're like, okay, we might have an opportunity for you. So with them, we opened up the first Fusion Physical Therapy up in Woodbridge, and our idea was to be a landing point for all of the patients that weren't really being appropriately served in the community.
Okay.
So not just the post-surgery people that were getting very well served, and there were lots of clinics out there that were treating them, but people that had vertigo, post-concussion, Parkinson's, MS, they've had a stroke, they've been pushed off with chronic pain, and they've been through several different places and getting no results. We wanted to be the landing place for that, so we wanted to just take all of these little pieces and kind of fuse them together, and that's kind of where Fusion Physical Therapy started.
Okay.
My wife's from the area, and we moved down here last year, and at the same time we opened up a Fusion Physical Therapy in Spotsylvania. That's all ours, and from there we've just started to really do the same thing, bring people in the community around this community that have kind of been underserved, that have had to go up north or down south to like Richmond. We can kind of keep them home here and start allowing us to get into the community and helping everybody feel a little bit better about themselves.
That's awesome, man. So when you say they weren't getting treated, so where was that disconnect? Because I would imagine, I'm surprised you said all those different elements, there wasn't a program for that. That's crazy.
It really is. There's a lot of subspecialties within physical therapy, vestibular rehab being one of them. A lot of clinics will say they actually do vestibular rehab, but they're really just doing balance training.
Okay.
There's very few places around the country where you can get appropriate training. Emory in Atlanta is one of them. I went to the Rehabilitation Institute of Chicago for my training, and that's just for me personally. A lot of these other physical therapy clinics, they're kind of small. They don't have a lot of the equipment that you need to really treat the neurological population. That tends to just be in hospital centers. And in hospital centers, they can get booked up real quick.
Okay.
And so around here, a lot of our patients were going down to like Bon Secours in Richmond or UVA in Richmond for their treatment. And when you have neurological problems and it's hard for you to walk and get around anyway, it's kind of hard to do a 1.5 hour drive, or sometimes in 95, a 3-hour drive for an hour's worth of treatment.
That would be slightly different.
Yeah. So that's really what started all of it.
Okay, awesome, man. So we met, God, what is it now? This is mid-April 2018. We met at a Freelance Star event.
Yep.
I don't even remember when that was. Was it August last year?
Somewhere, it was in the fall.
Yeah, it was a health fair they had, and you guys were standing next to us, and we just started talking, and kind of, had a connection there of helping people. And it's funny, we're standing in a room, and everybody's quiet, nobody's talking.
Yeah. Networking and supposed to be talking, and we're all just sitting there like, well, this is fun. You want to go get a donut?
It's like, what are we doing here? So we kind of hit it off, and just talking to you, and I know, was it Mike, the guy who works for you?
Rich.
Rich.
Yep, Rich Gaudio.
Okay. Rich, though, yeah, you guys had more going on. Like, hey, we need to get in the same room with you guys more, and what's going on.
Yeah.
And here we are, I guess 7-8 months later, and you and Jericho and Complete Nutrition, a Live by Design chiropractor, we're on a mission to make Fredericksburg the healthiest and fittest city in America.
Absolutely.
So what interested you? What drew you into that? Like what, again, I know when we talked about that initially, your ears perked up.
Yeah. So one of the things within physical therapy is we get you to a certain point where you're independent in the community, whether it's just post-surgical, so you just had, say, foot surgery or a rotator cuff repair. We get you to a certain point where you're functional, but maybe you're not at where you really want to be. There's this gap between the end of a care of physical therapy and where you can appropriately start getting into the things that you really want to do. So with CrossFit, for example, in boot camps, somebody that's 6 weeks post discharge from a physical therapy plan of care for rotator cuff repair isn't really ready to start getting into like kipping pull-ups and clean and jerks and stuff like that, right? And so in talking with you, we started realizing, hey, we can really collaborate together to kind of have this bridge, this program where we're dealing with some people that want to be CrossFit athletes or other people in the community that want to become healthier and fitter. They go to rehab and they've liked what they've started to do. They start getting in better shape. They start moving around and they like how they feel. And then it ends, they don't have any place to go.
Right.
And then they just kind of fall back into their normal habits and routines.
Yep.
And so one of the things that I loved about talking with you and Rich as well is we have this community of people that are just kind of in a void. And we might all come in and be like, hey guys, we can help you with that void.
Awesome. Yeah. And it's funny you say that because exactly, hey, we love doing what we're doing, CrossFit, but there's definitely a misconception. You come here, you have to evaluate an athlete when they come in. People don't come to you, to your place of business, and you don't know anything about them.
Right.
You evaluate them, or you know about them before they get there.
Right.
And service them appropriately. So it's the same thing here when they come to Rare. That's why we do our experience, which Travis and Jericho and Mitchell with Complete are all a part of, bringing people in, evaluating them to say, okay, you need personal training. Our boot camp will be a great start. Our CrossFit program will be great, or our foundation. So I love hearing you say that because many gyms don't do that.
Right.
Like, hey, you want to get in shape? Awesome. Let's go.
Absolutely. Well, one of the things in talking with you and one of the things that I really liked about Rare, I've been around a bunch of different CrossFit boxes and treated a bunch of CrossFit athletes and heard how different boxes run their programs. One of the things that's really special about Adam and Rare is the foundations class itself. Too many times people are out of shape, they haven't been doing anything for years, and they're like, you know what? My friend just lost 60 pounds in CrossFit, they're in the best shape of their life, and they're 55 years old. I got to get in on that. So they go to a box and they start doing like 55-pound kettlebell swings and they throw their back out.
Yep.
And then they never go back because they were at a bad box. The foundations class that you guys have really helps to bridge that gap where, okay, you're completely biomechanically dysfunctional. We got to get you to learn these movements before you can set off on the path that your friend was on, where they've been doing it for 2 years and have lost a ton of weight and are in great shape, even at 55 years old.
Yep.
And so I think what sets you guys apart from a lot of other CrossFit boxes is that foundations class.
Yeah. Well, hey, we appreciate that, man.
Yeah.
Absolutely. Well, and again, it gets back to you. What sets you apart is a bigger vision.
Absolutely.
Right? You don't want to just be the physical therapist. Hey, I got my scripts, our recommendations, referrals, boom.
Yep.
You have a bigger vision, Travis. So, kind of what is your bigger vision? You just opened up a new office.
We did, right in Lee's Hill. It is in the Trong Rehabilitation Center. So that's going to be office number 2. And for Fusion, our big idea, our big thing is to, in a way, revolutionize the way that people have an experience with physical therapy. Too many times, people think of physical therapy, oh, I got this script from the doctor, they're going to come in, you have a flow sheet that the doctor has designed, you just blindly follow that, and then after, say, a month or 6 weeks, then you get discharged. We're a little bit different than that, and our vision is to keep spreading that throughout, not just the community, but around the entire region, and maybe even beyond, where we really sit and talk with a patient, we get to know them, what their goals are, and especially their history. Most of the times when we're dealing with somebody, we're not really dealing with an acute injury. We're dealing with an acute flare-up of a chronic injury that they've been dealing with for years.
And that's a key difference.
It's a big difference. Big difference, right? And so we dive into your history and we get to know you, we get to know your family, and all of the patients that come through our doors end up becoming kind of part of our family. And in a way, we don't like kicking our family out the door after a meal. And so we developed our Better You program. Our Better You program is working with community partners like you, where when you're done with your therapy and you've started to really reach all your goals, we're not just going to drop you off the face of the earth.
Right.
We want to be able to have you keep coming in. You've met people in therapy. You've gotten to know them. You guys can keep coming in, staying fit, staying healthy. If you want to go beyond just the minor therapeutic like rehabilitation equipment that we have in our facility, we have community partners like yourself that we can refer you to. You kind of know where we're coming from. We know where you're coming from, and it just makes a really good match. And so we want to keep people on a goal of sticking with us. You become part of our family. We want to take care of you. We want you to live very long, healthy, wonderful lives.
Yeah, absolutely. And I love how you said it. It's community, it's a family.
Yeah,
you're right.
Absolutely.
Hey, come get service by us. We'll see you later. No, not at all. We're building relationships.
Right.
That's how to start to get Fredericksburg healthy and fit.
Absolutely.
You have to have strong relationships.
Yep.
So you've got more than just your physical therapy and your Better You. You also have something called Rock Steady Boxing, right?
Absolutely. Rock Steady Boxing is a really fantastic program. It's a national program fighting back against Parkinson's. So Rock Steady Boxing, my colleague Rich Gaudio just became certified in it, and we are the local affiliate, so it's Rock Steady Fredericksburg. And people with Parkinson's can come in, learn boxing moves, and it's pretty amazing that the act of boxing with its rhythmical progressions really helps to fight off the progression of Parkinson's. It's a really fantastic program that we just started. Right now we have 8 members, and it's only been really 3 weeks old. So it's a very, very popular program. Again, when we were talking about people traveling, we had people traveling all the way north to Arlington and all the way south into Richmond to get this service. So we saw, again, a void in the area, and we wanted to fill that. And it's just a really fantastic program. Bunch of people get together. They keep coming at the same time. They get to know each other, just kind of like a gym thing. They become a community. We do stuff with them outside of that as well, with support groups and educational premises. And it's just a fantastic way of people with Parkinson's to fight back against the disease.
Yeah. So if you guys, again, as you're watching this, you can see, Travis's devotion to community and really helping people. I remember when we opened up Rare, we're celebrating our 10th anniversary this year.
Yeah, congratulations.
Thank you so much. Yeah, coming in October, but that was our biggest thing of we wanted to name something that was unique and different that people understood, why did you call it Rare? Because, we wanted to be about people and relationships and really making our community better, not just fit, really having that community, Because the definition of community, it's meaningful relationships.
Yep.
And building it and really, really helping people, live the lives that they really want to live. Because you said there's so many people walking around with chronic illnesses and disease.
Absolutely.
And so miseducated.
Right. And one of those things, our partner, Dr. Jericho Matthews, there's also a misunderstanding about chiropractic. And I would say, unlike a lot of other physical therapy practitioners, I actually view chiropractic as a need in the community as well. If you're coming in to see me for low back pain, there's a lot of muscular things that we can work on and particular dysfunctions that we can work on. And we can get you out of your acute pain. But if you're continuing to have locking joints and subluxing things, and I've manipulated you a couple of times and it seems like, okay, you have something else going on from a physical therapy perspective, we can keep you going down stabilization street and working on all of the muscles. But I know that there are other people in this community that could better serve you. We can only specialize in so much, and the lumbar spine, just as an example, has multiple different segments just within one tiny little piece. And so a disc, a facet, anything along those lines, the muscles that are attaching to it, there's so many different joints and structures that could be in that you pretty much need to be a low back expert. And we see this a lot in physicians as well, right? You go to see the surgeon, you're like, hey, you did my shoulder, can you do my back too? Oh, no. You go see the specialist for that. And to me, we start getting our little subspecialties. The one that I really fell in love with was vestibular rehab and post-concussion syndrome, and that led to also temporomandibular joint dysfunction. And that's kind of started to become my specialty. And I can do tons of research into that and all the upper cervical area and look in different types of vertigo, dizziness, and balance problems that arise from that. But if it's in the lumbar spine, I go around and I teach other people how to initially treat it, but I also know that chiropractors focus all of their attention really on the spine, and they are really, really experts on that. And Dr. Jericho, I do refer patients to him all of the time for continued spine health. And I think that that's, again, building a fit community is partnering with people that you kind of have to humble yourself and know that, you know what, I'm really not an expert in literally everything. And Jericho and I have been referring patients back and forth, and it's amazing how our independent outcomes have been skyrocketing.
Yeah.
So it's really fantastic.
Absolutely. Well, and it's funny too, so I'm glad you brought that up, Travis, because a lot of people are they have misconceptions about physical therapy. They have misconceptions about chiropractors. They have misconceptions about CrossFit.
Absolutely.
You know, we really, I was a broken runner many years ago, and I found CrossFit on an accident from a female friend of mine. And she introduced me to it. I'm like, oh my God, I love this. But it absolutely kicked my butt at first.
Yeah.
Because I didn't know a lot of the movements and things like that. I was a runner. So part of the mission of us was to educate people, it is the best functional fitness, I believe, for everybody.
Absolutely.
Because it's so different, right? And you can have so much bang for the buck, the efficiency and the effectiveness. Jericho, we've had a lot of people say, hey, Adam, you guys send people to Jericho when they're hurt. And we're like, not at all.
Right.
We send them for prehab, right, to keep you aligned. Because like if we sat here for 10 hours a day, that's not good.
Right.
We're going to get weak, right? Everybody knows that if you sit a lot during the day, you're going to cut years off your life expectancy.
Absolutely.
So we send people to Jericho because we know he's going to take care of them and keep them aligned over the long term. Same thing with you, Travis. We have doctors in our gym, and we make sure they understand, hey, we love how you treat people for physical therapy. Are you guys referring them to Travis because how much you care?
Absolutely.
And that you understand, like, hey, I can't fix everything. I'm going to focus what you said about what you do.
Right.
Love that, man.
Absolutely. And that's the thing. We have different practitioners that are focusing on different things. So, like Rich Gaudio, he's really into Parkinson's specifically, and he's really the Parkinson's expert in the area and the region, but he also does a lot with the rest of the neuro population. And I'll see them and I will treat them, and I can take them to a point given my history. So one of the things that I did is that I partnered with Dr. Ashley Rowley, who is the director of our Lee's Hill Clinic. And we really, really were co-treating a teenager who dove headfirst into a wave in Ocean City. Long story short, he was given a 4% chance to walk. He came to our clinic and struggling to walk in loft-strand crutches, which are the forearm crutches. We tag teamed with him. We're seeing him 4 times a week. And our main goal was to get him to walk across stage at high school graduation. With all of the rehab we did, we were able to accomplish it. It was amazing. None of the students in his high school really knew that he was even capable of that. And so he took his wheelchair up the ramp at the high school graduation, and then he stood up in front of everybody, and he was able to walk across stage using just a cane, shake the principal's hand, get his diploma, and then walk out of the auditorium. And it was amazing. It was a standing ovation. Everybody was crying. It was just a fantastic thing. That's one of the things that we really love being able to bring to the table. I know that I can treat them from my history.
Right.
But I also know that Rich has been doing it a lot longer than I have. And so I can refer to him. We have a new hire, Dr. Delisa Cummings. She loves being in with athletes. Athletes have never been my particular forte.
Yeah.
She is really, really good at them. Amazing with them because she had a history of being in cheerleading, and now she is just really, really fit and really wanting to get in and working with athletes as well as women's health problems. And so here we are, again, getting into the little tiny niches that most general orthopedic practices aren't going to find.
Right. That's awesome, man.
Yeah, it's really amazing.
Love it. Hey, guys, so Travis, what patients do you generally see at your practice of fusion physical therapy?
Yeah, so there are a lot of physician-owned practices in the area, orthopedic surgeons that will refer to their own physical therapy practice. We don't particularly go after them. As a case in point, as any kind of a patient with any kind of medical decision, you are actually in control of that. So anybody can never exactly tell you where to go. So as anybody going through an upcoming surgery or anything like that, make sure you do your due diligence, research the clinics, and make sure that that's a place where you really want to go, because you actually are in charge of that, and you can go wherever you want. We tend to service the people that have really been underserved or not served well. And so the kind of patients that we like to see at our clinic are people in chronic pain. We will see people post-surgically, but again, that's not really the patient population that we're going after. We like to treat patients that are generally above the age of 45. They're weekend warriors. They want to stay in shape. They want to stay fit, but they keep breaking down.
Right.
So orthopedically, you want to look at your chronic pain, analyze your biomechanical faults, and fix them. You mentioned sitting for 10 hours. We know that's not bad. Well, one of the things that we've commonly seen is gluteal activation dramatically decreases as we age.
So hold on, Travis. Gluteal activation.
Gluteal activation.
So basically your butt.
Your butt, right? What do we do all day? We sit. We're a community of sitters now across the country.
We're
right?
not.
Right, we're not.
We're not.
But in general, the community is a community of sitters, not just here across the country, especially in this area. People are sitting in their car, driving up north for 2 hours, then they sit in their cubicle farm, and then they drive another 2 to 3 hours home. Yeah. And they do that 5 days a week. Yeah. A lot of people miss that. A lot of people don't realize what kind of muscles aren't functioning right, and that's part of our evaluation. We treat patients that have neurological dysfunction, so Parkinson's, MS, strokes, things of this nature. And that, like I said, Ashley at Lee's Hill, she also specializes in neurological dysfunction. And she is right now trying to find her own little subspecialty. And then Talisa Cummings, her patients tend to be more of the fit athlete types. But Fusion Physical Therapy as a whole, we're really looking to serve that 45 and up, that population that just wants to stay healthy. They're weekend warriors that keep getting hurt. They just want to play with their kids and grandkids, and they're having a hard time bending over, picking up their grandkids. Their back hurts, their hip hurts, their knees hurt. Yep. We want to take them to a point where that doesn't happen anymore.
Awesome, man. Awesome. So, hey, Fusion Physical Therapy, where can people find out more besides this? An email address they can email you?
Absolutely. So we have info@fusionpta.com. We have a website, www.fusionpta.com. Our clinics are at Lee's Hill at Trong Rehabilitation Center, which is on Spotsylvania Avenue. It's right across the street from the Lee's Hill Medical Plaza. And our main clinic is right off of Spotsylvania Parkway, directly across the street from Mary Washington Health Pavilion, right behind where Planet Fitness End is, and across 95 from where Spotsylvania Regional Medical Center are. Our phone number is 540-710-0100.
Awesome, man. Well, hey, man, appreciate your time.
Adam, thanks for having me.
No problem, man. So, hey, guys, again, Dr. Travis Stoner from Fusion Physical Therapy, Coach Adam, Rare CrossFit. And again, we're on a mission to make Fredericksburg the healthiest and fittest city in America. We love your help and support in that mission. And if you need anything, email or call Dr. Travis or call us here at Rare. So, appreciate you guys. Thanks for watching, and we'll see you all next week.
Thank you.